Okay, well, I think I'll start off with some introductions. I do see some people that are still jumping on for this. And just wanted to say thank you on behalf of our panelists today for agreeing to join this conversation and share their insights with us. My name is Jill Cezek. I'm in the Office of the Vice President for Health Sciences. This concept was actually came from Dr. Ariza Balaga. He is the director of, Gustavo, am I getting your title wrong? Faculty
I'm the
Affairs.
Senior Associate Dean for Faculty Affairs.
Thank you. Sorry about
No
that.
worries. No.
Gustavo has done something similar to this at previous institutions quite successfully. And he really thought that we should be tapping into the talents and the resources that we have amongst our faculty in order to basically help people who might be less familiar with the NIH process or more early career, or actually just even wanting to learn a little bit more and get another perspective. So I thank him on behalf of our team for the suggestion and the partnership in this. So I'll let you know how I invited our panelists today. I reached out to Dr. Lazarus and Dr. Temple because my office is situated in a lot of data, frankly. Always looking at numbers, looking at direction, not only here within the institution, but also at the national level. And both Dr. Lazarus and Dr. Temple, they jump off the charts when it comes to the success that they've had in the research environment and the competitive space. So I called and said, would you please be willing to do this? And they said yes. So I want to thank them. Dr. Temple is in the School of Public Health and Health Professions, and Dr. Lazarus joins us from the School of Pharmacy and Pharmaceutical Sciences. Before we get started with just some basic questions, do either of you want to say anything to just introduce yourselves? I mean, you've both been funded so heavily and so continuously. I don't want to put numbers up on the screen in front of everybody, but it is the case. So
I can just jump in and say my continuous funding streak is about to come to an end in this current funding environment. So, but it has been a very enjoyable ride. So, I certainly am not one of the most well-funded people here at UB, but I do have a lot of experience, particularly with NIH. And I have had a lot of NIH study section experience, both with the old system and with the new system. And so I can definitely offer some insight into the new way that grants are being evaluated. But I'm happy to answer questions about any of those things. And thanks for inviting me, Jill.
thank you. Dr. Lazarus?
Yeah, it's a pleasure to serve on the panel with Jennifer. I see a couple of people from pharmaceutical sciences are on here. Anne and Jason are here, and that's great. So just real briefly, so I've only been here less than 2 years, since June of 2024. I was at several other institutions before that. I basically started my grant funding in 1995. I was 35 years old. I was pretty young to get my first R1, I guess. And I've had a number of R1s, and I was a PI of a program project. I think the biggest piece of advice I would give a junior investigator is don't give up. And a 30-second story for me was when I put in my first R1. I got, this is back in the day before things were triaged at less than 50% sometimes. So I had two not discussed and one a score of 42, which was under the 50 percentile. I was pretty frustrated. I put it in a fourth time with 3 days left in the cycle. I revised it and I got a 2 percentile. So it went from a not discussed, almost a not discussed 3 times to a 2 percentile. It's ridiculous. So don't be discouraged. That's my biggest piece of advice. You just don't know. And we can talk more about that as we go through the course of our discussions.
Yeah, I actually want to echo that. My KO1 got funded on the third submission, and the first one was a not discussed. And my last two R01s, one was funded on the third submission, and one was funded on the fourth submission. It is
Right.
you just have to be relentless. You have to be willing to take the feedback from the reviews and figure out a way to address it, pivot, while staying within the realm of what you want to be doing and what you have the expertise to do. So I think having a thick skin and being persistent is probably the biggest takeaway.
Right.
Thank you. So, Dr. Temple, you actually, one of the remarks that you made in opening was about the differences and the changes that have occurred, especially within the last year or so. And I'm not talking about the changes with the abysmal effort for the coordination of federal funding that we were all extremely anxious about and sort of has slowed for a period of time. But I'm talking about the review panel itself and the criteria and how scoring has changed. Do you want to comment on that at all?
Sure, I would love to. And I can talk about the logistics of it, but from the perspective of somebody who has both gotten a lot of grant reviews and also served on study section, I actually quite like these changes. So, the biggest change from both a reviewee and a reviewer perspective is just we've really streamlined the review process to focus on the things that are really the most important score driving factors. So, significance and innovation is sort of clustered together under one score driving factor, criterion one. And then the approach is really clustered under the second one. And the investigator, which used to have an outsized, not outsized, but it used to be 20% of the score was from the investigator. And that really when you were sitting in a study section, the conversation would really be like, oh, this person is so well known, or this person has a fantastic reputation, or this, and it really put junior investigators at a disadvantage because how are you going to compete with somebody who has such a long track record of funding? And so having grants written by people who had a long history of NIH funding, that reputation really drove that discussion, and it gave them an ability to have 20% of their score really be much higher. And so now it's like, can the person do the work or not? It is, and I will say that in study section, at least the ones that I have served on since the new criteria, the SRO will actively push back if people start to veer into, oh, well, this person has been doing this for decades, or this person has a reputation, or the opposite, like, well, this person has never had a grant to do this before. The conversation is cut off. We undergo training before doing the training on the new criteria that really emphasize, like, you're not allowed to talk about investigators the same way. Are they adequate or not, period. And there's no score tied to it. And then they also got rid of the sort of environment, which was always a weird one. It's like, it was very rare that anyone got dinged for anything like if you have the facilities and the space, and which most people did. So that one is just sort of like gone now. And so it really focuses the discussion around these two primary criteria. And the other thing that is different that I actually really like is that the significance score, that significance and innovation, that criterion one score sets the cap. So like that one is actually weighted more heavily. So if you give somebody, let's say, like a 3 for significance, their overall score can't be any better than a 3. Like, so it can be worse than a 3, but it can't be better. And so if you want to give someone a really good score, it better be significant. And so beyond the approach, like, the significance sort of becomes kind of the most important thing. And the significance is really like, should we fund this? Not can the experimenter do it, not are they studying an important disease, but is this particular grant going to move our field forward in an important way? And so I think as I'm writing grants now in this new environment, I am putting much more of an emphasis on that significance piece of the grant and much less emphasis on, other aspects of the grant. It still has to be a good grant. But I don't want to talk too much because I want to leave people time for answers, but that is my impression. I also really like that we're only discussing the top third. Again, people don't like that, but it makes study section way better. If you had a 48th percentile, it was never going to get funded ever. And that competitive not discussed actually feels a little more hopeful. It feels like, okay, this is something worth revising. There's just some things that they didn't like about it. Whereas before it was just scored or not discussed. And I actually really like this sort of like discussed, competitive, not discussed, and then, okay, maybe you should make a different choice with the not discussed, not discussed. So.
Dr. Lazarus, do you want to add any comments on the same? far as the
No,
changes that have occurred and how your approach is different?
I think Jennifer summed it up as about as well as you can sum it up. The only thing I would add is on the negative side, a lot of the reviews these days, it seems, I'm not sure if they're going back to in person, but they have been Zoom. And I would say that the Zoom reviews are not nearly as good. I find that you have the three reviewers talk, and then there's very little discussion afterwards. So that is a potential problem, but I hope that in the near future they will be going back to in-person reviews. I know that traveling, especially from the West Coast to the East Coast, is always a problem, but I think it's much more worthwhile.
There's discussion of them, or at least there was, going to one in-person meeting a year and two remote meetings for each study section. Because they're saving so much money doing them on Zoom, that it would be hard to justify the cost. But the reviewers have really pushed back about the value of the in-person meetings. I will say that it's really study section dependent, and I've been on 3 different study sections in the last 8 years or so, and there are some where there is a very robust discussion after each grant. So the other thing that they got rid of is that the in study section that the chair does no longer summarizes each grant after, and which saves quite a bit of time. So
So if we can just, especially for people who might just be getting started in the process and are more early career, over the time that you have been applying for competitive funding and the number of different awards that you've each gotten, which is phenomenal, how has your approach to actually planning to submit changed? Like, when you first started and put your first, submission in, whether it was a K or whatever, how do you tackle it differently now than you did back then?
Well, all right, so I'll start off. Um, I don't know if I do it any different, quite frankly, and maybe I should change more with the times. But I think you have to be able to tell a story. It's so important. It's not so much the grammar and the punctuation, although that is important because, a reviewer might think that if you don't take care of those kinds of things, it looks a little sloppy. But the most important thing is to be able to convey what you want to do and why in a nice, rational way. And so I tell all of my students and all of my postdocs when they're applying for grants, that's what you need to do. Tell a story and justify why your study is important. And I agree with Jennifer 100%. The significance of your grant is the most important thing that you have to think about. Um, and as far as the approach and the methods, don't get bogged down in details. Don't describe how you're doing a Western blot, you know, right? Just don't get into the minutia of your approach. Just generally describe what you're going to do, and if it makes sense. I think much more attention, if you're thinking about approach, should be you should be thinking about rigor and how your studies can be validated within your approach. And so multiple ways and to show the same thing, how you're looking at all of your resources, your cell lines, etc. Are you validating everything that you're doing? That's what I would focus on more in terms of the approach to make sure that that is addressed. But don't get into minutia for sure. And that'll save you space for the significance. You got 12 pages. And it's amazing how fast that space will run out on you. Also, I think it's important just from a reviewer aspect. I mean, we've all been reviewers, I hope, for different grants. You want to have space between paragraphs. Don't want to jam everything in. It gets very difficult to read. So I would advise everybody to try to make sure that you think about that as well as you're writing your grant.
I think that's really great advice. I would echo that. I think that I wish everybody could start out before they write their first grant serving on a study section, and then work backwards, because reading other people's grants and then seeing what grants do well in the discussion is really informative about like, okay, like now I realize that when I'm getting bogged down in these methods and using this really technical jargon and using a lot of acronyms, like that's not very helpful for the reviewer, and telling a really nice story that really emphasizes the significance. I do a lot of repetition. At the end of my specific aims, I have a paragraph that's like, this is why this is important. And, you know, throughout my grant, just like highlighting why, you know, why this is significant, why this is going to move the field forward. So I think my grants have become a lot more focused on that and a lot less focused. When I first started writing grants, it was like, I need to show them that I can do this study, that I have the technical expertise to do this study. And the assumption is that you do have that you can do the study, right? That's they're going into the grant with the assumption that you can do it. And so you don't need to, unless you're doing something really new that you haven't published on before, maybe you need to show some preliminary data. But really, like, why is this study important? How is this going to advance the field? Is the most critical part. And so I do that a lot. The other thing that I have started to do is try to anticipate things that reviewers might be concerned about and address it right away. So I put these little boxes, and I usually color code them, and I'll write like experimental design considerations. And I'll write in there like, we did consider doing a within subjects design, but we decided to go with a parallel arm design for this reason, this reason, this reason. So, you know, put that right in there, because it just gives the reviewer an insight into how you came up with this design and that you did consider other things, because their comment might be like, oh, well, why didn't you think about doing this? And so I find that having those little pieces in there that are like, it just adds to the rigor, like, oh yeah, you understand this field, you have thought about these things, and you have a solid scientific rationale for why you went the way that you did. But those are just a few, those are like really minor things. But I think overall, the real emphasis on significance is a way that my grants have changed over time, and simplifying and telling a nice story.
And one of the things that Jennifer just hit on, I think is really important. Think about it from the perspective of a reviewer when they have to read 10 grants, right? For every review, for every study section. It's a lot of work, as you know. Avoid acronyms if possible, especially those three-letter acronyms. You're trying to abbreviate things so you can squeeze things in. Don't do it. Do not do that. Because it drives me crazy where I'm on page 6 and I have to go figure out what that acronym where it was somewhere in the document. It takes me an extra hour to do these things. So try to avoid that unless it's like an oncogene name or something like that. Don't try to abbreviate everything. So pay attention to those kinds of things. Think about it from the reviewer perspective and in terms of their reading your document.
So that actually brings up a good point and a question that we wanted to pose. So you have both said it would be great if actually people had a chance to review first before they write their first. And you both have actually, you know, you've written a lot and then you've actually reviewed quite a bit. So to the point of acronyms, like Dr. Lazarus, what's another mistake that you see consistently as you're reviewing, or something that you've done in the past that people should avoid other than the acronym aspect?
Yeah, no, I mean, I mentioned things like just make sure you don't put in a grant that is I hate to use the expression half-assed. Okay. Make sure that it's the best possible job you can do. Because don't forget, these are your peers. Your grant is going to go in again, maybe to the same people. You want to make sure that your grant looks and reads well, and makes sense. So don't rush things. I know we're all under our clock and we're under a lot of pressure, but try not to rush things. Make sure it's really a good and well-written grant. So if you're thinking for a June 5th deadline and you're still writing right now, I would, and this is your first R1, I would wait. I would rewrite it or revise it and reread it and maybe ask somebody else. That's also very important. I don't know about all colleges. It's really good to have a mentoring committee who can go over your grant, or someone that you trust to read your grant. And of course, that also takes time. So that's why I wouldn't rush things. And I did it in when I first started out. I don't do that anymore. I think I've had some success. So that would be my major piece of advice.
I would echo that. Try to get things done early so that first of all, so that you have time to share it with people who can give you some critical feedback on it. But also just so that you're not cutting corners, making mistakes, rushing. Give yourself plenty of time to do that. I would say in terms of like from a grant reviewer perspective, just don't try to jam every single word into these pages. So like if it, we're all kind of running up to the limit, but don't like when I open up a grant document and I see like the smallest possible font and like no space and everything jammed in, like it just doesn't look nice. It takes a long time to read. It's very laborious. Like really try to think about what is the most important thing that you have to say. You don't have to say every single word. So I think I think we're hitting on kind of the same themes, like, you know, jargon and abbreviations and, making things too small. And, I also think that like from a positive side, one of the things that I tend to like about grants is less words and more pictures. So anything you can do to represent something with an infographic, or some kind of a figure. If you're, a lot of the grants I write involve having conceptual or theoretical models, like anything you can do that is in picture form just breaks up the monotony of reading the words. And I think it's a really nice way to sort of show things in a different way. And so I find those grants really appealing when they use kind of graphics in a way, not graphics in a way that like isn't contributing to the meaning, but graphics in a way that really helps make the grant more understandable for people. So that is something that I find that I like.
I can just add a quick comment, and I had this on the list of things that we were going to talk about, but it came up now. We do have some resources on campus that people should be aware of. So at least in the office that I'm situated in, we actually have a design person that we can go to with sufficient notice. Like Dr. Lazarus said, like don't think that you're going to do this 2 days prior to something needing to be submitted. But we do have somebody that if you have something that you want to either visualize, she can help work through that. Or if you have something that you've done yourself, a lot of times she can look at what an investigator has prepared and help polish it a little bit. We actually had a great conversation with her, I think last week. And if you go to our YouTube channel, you can see some of the resources that we have in that regard. There's also an office on campus, the Office of Research Advancement, which falls under the VPR's office, and then our office as well. Sometimes we have an opportunity to take a look at things, and if somebody needs a good look at a last edit, or skimming out, sometimes you say these things that could be said a little bit more succinctly if you're coming at it from an outside perspective. And so we do have those resources available if anybody is interested. Dean Wysocki is on, and she has not only great success in the space, but she's actually worked at NIH, and we were fortunate to bring her here to Buffalo. So she had basically said anything that makes the grant application reviewer friendly. So she's agreeing with both of you to, don't cover every inch of the page and to make it a little bit more readable. So now can we talk a little bit about what you've seen from your perspective in how innovation can be posed within a proposal? Because obviously that's one of the things that they're looking for with significance and innovation. So how do you approach that and make sure that you're weaving the fact that what you're doing is something new and will benefit your field? Dr. Temple, you want to go first?
Sure. I'm like, how do we figure out who goes first? I will say the innovation section of the grant is the one I struggle with the most. And I have tried to get in the mindset of it doesn't have to be, so the work I do a lot of behavioral work. I'm not using any like advanced technology. So sometimes it's easy to talk about technological innovation. But when I write the innovation section, I really try to think about what am I doing that hasn't been done before? So a lot of times it's like, we're taking two fields, these fields have been studied in a siloed way, and now we're going to merge them. We're going to look at interactions between these two things, or, or trying to think like a lot of this stuff has been done in an observational way, but we're going to do it in an experimental way. So it's really just highlighting like the things that this study will do that haven't been done before, but really also using it as an opportunity to reiterate how it will move the field forward, which sort of is like this intersection between significance and innovation. But my innovation section is usually pretty short. I use bullet points. But that one is pretty challenging for me. So sorry, I can't be more helpful.
Yeah, no, it's funny that you mentioned those things, Jennifer. I also use bullet points, and it is a tough one. And also, I think it's reviewer. It depends on the reviewer what they think innovation means. And some reviewers, some investigators think innovation means the methods. Are they innovative? I don't view it like that. I think I'm more along the lines of what Jennifer said, and that is, how is your approach to a specific problem innovative, rather than is your method innovative? I hope that most reviewers think that way. But yeah, it's usually the one area that most people who write grants have the problem with, because there's a lot of variation there in terms of how a reviewer will think about that concept.
Yeah, and I will say, we're trained at NIH trains reviewers all the time, especially when there's new ways of doing things. And you are trained to not focus on technological innovation. And the way that NIH defines innovation is really like, again, shifting paradigms, novel concepts, novel integration of different areas of research, novel conceptual models or approaches. And so I think just really thinking about, obviously, there's something unique about whatever you're writing. You're not going to write a grant that is an exact replication of something else that has been done. So really tell the reviewers what it is about your grant proposal that makes it unique compared to other fields. Oftentimes the work I do feels pretty incremental. And that's something that, I've had people comment on my work, well, this is incremental, but in my experience, NIH, even though they want to take risks, they actually feel safer funding incremental work. And so I think you can do incremental science, and there's value in doing incremental science, but talk about, how this incremental science is still moving the field forward and how it is innovative relative to the literature.
So from the perspective of, so that's the innovation part of it, but then the other element is obviously the significance. So that's probably the more fun section, I would say, to write. But do you have any tips for investigators on how you approach that? And basically, it's the selling part of what you're trying to do, right? So do you push it really far and say, I can do this? Is there some balance between not only I can do this, but I anticipate some potential challenges? I mean, how do you tackle it in order to get an application funded?
I'll go first this time. We'll switch. Yeah, you just mentioned something, challenges. I wouldn't bring that necessarily up in terms of your approach. I would leave that for your approach, and there should be separate section. We'll get to the approach afterwards, I guess. But I wouldn't necessarily. I I would stress the importance of your studies, and don't bring in negative components within the significance as much as possible. Just talk about why your studies are so important. And yes, I think that you have to be mentioning if there's something that's out there that might be a little bit against what you're proposing to do, you have to cite that, but then state why. But don't talk about what you're going to do and why there might be a negative to that. I wouldn't do that in the significance, but I think that's something that's saved for your approach, because there's a section there should be a section in your approach which addresses that. And again, we'll talk about that later.
Yeah, we're on the same page. I would echo that. The significance section is, it's really where you talk about the state of the literature, because your grant has to be built on a fairly strong foundation of, so this is what we know, which gives us reason to believe that our study is important and successful. So you have to describe the literature, but then you have to describe, and I have a section in my significance section that's called gaps in the literature. And I talk about like, yes, we know this, we know this, we know this, but we don't know this, and we don't know this, and we don't know this. And then I say, you know, all of these gaps in the literature are keeping us from advancing our field. And this is how this grant is going to address these gaps. And so that's really what you should do. Like, here's what we know, here's what we don't know, here's how I'm going to answer the questions that we don't know, and this is how it will move my field forward. So that is sort of how I approach the significance section. And you do want to obviously talk about limitations to what you're doing, but save that for the end of the approach. Rihanna, do you have a question?
Yes. So I tend to fall into this trap in the significance where I talk about the literature and then it starts to sound like a lit review. And I kind of move a little bit less from like, why is mine significant to like, but they're going to want to know everything. And of course you don't. So where do you see the line between like how much is enough and how much is too much, or just how do you go about that?
Yeah, so when I start writing my grants, I end up I think about my problem like at the big, you know, at the end of my aims, like what I'm trying to say, what is my goal, what are my aims, and then what literature do I need to briefly review that is directly related to my aims. And you know, sort of the most important things that are also gaps that I think I'm going to address. You should have a reasonable expectation that they're going to do their best to assign people to your grant that have a knowledge of kind of where the field is in general. And so you're not expected to review everything about everything. So in that sense, you know, be really focused. There are times when I'll read a grant and their whole significance section is like a page, and I'm like, I feel like you need a little bit more. But then there's some where it's like half the grant, and you're like, too much. I didn't need that much. And so it is kind of a fine line. But I think just being really narrow, anytime you're veering off into a space that you're not going to directly address in your grant. Also summarizing, like if you can find a meta-analysis, great. Like you don't need to go through like you would in a lit review where you have to review multiple papers and talk about the different methods from different papers. You know, just try to, you know, come up with the most seminal papers or with a meta-analysis that can really speak to kind of when we merge all of these papers together, this is what the findings are. So I don't know if that's helpful, but
Yeah, so one of the things that I do, it happens. I always write way too much. And I'll have 13 to 14 pages, and then I take a week off, and then I come back to it and I say, okay, do I really need this or do I really need that? Do I have to point every little detail? Is that really relevant to what I'm trying to go after? And so, yeah, I think it's a good approach to write everything you think that is important, but then go back to it and then ask what you think you really need there. And because you don't want to, also, you don't want to open yourself up for criticism. Okay, so you might be saying too much. So try to keep it focused on the problem at hand.
we started writing grants back in the day when they were 24 pages, and so some of us used to write much longer grants.
Yeah.
So you both have mentioned, and thank you for the question, Rihanna. Do you want to talk about the approach section and any tips or suggestions that you have for people in regards to that element? Dr. Temple, it's to you.
I forgot it was my turn. Oh gosh, I don't know. The approach section is probably the easiest to write because you're telling them what you're going to do, and you know, but again, you don't want to get bogged down in details about stuff that, and look, you don't need to tell people how you're running a PCR. You don't need to tell people, like, I don't need to tell people all of the little minute methods about what we're going to do. That I can refer to published papers, things like that, you know. So it's really just I always start with the big picture, and this is just my grant writing approach. Everybody has their own style. My structure of my grants is very similar. So I really try to start with a big picture, with a conceptual or a theoretical model that everything builds off of. And I try to go back and reiterate that model to point out like like how my different sections of my approach are going to address different parts of the model. So I try to have my methods build off of that model. So like, let's say that I'm using the social ecological model, I might color code it, and then I might make a table of all the questionnaires I'm going to do and have those color coded. So the green ones match up with this part of my theoretical model, the blue ones match up with the blue part. Try to make it real easy for reviewers to see, like, okay, I can see the big picture, but then I can see how the actual methods of this grant are going to link back to that big picture. This isn't as applicable for people doing more basic science work or whatever. So every grant is really different. There's also some debate about where to put preliminary data. And some people put preliminary data in the significance section, and some people put it in the approach. And I tend to put it in the significance section. Like, this is what we have done in this space. But sometimes you want it in the approach if you're going to try to show, like, we've done this method before. So we've done this, I don't even know, single cell recording, or some fancy thing. Like, then you might want to show preliminary data there as well. So I always start with the big picture. I also describe the investigative team in this section. Like, these are the people that have the expertise to do all of the things that I'm going to tell you about. And then I really go through the methods, and I try to, again, talk about the actual measurements we're using and the rationale for picking those measurements. And then I always have a potential pitfalls, limitations. They want to see that you have thought about, like, well, if this doesn't work, how am I going to pivot? What else can I do to address that? Rigor, or the biological variables that you've thought of. We always have to think about age and sex and things like that in our studies. And then I usually try to end with linking everything back to the significance. Like, at the end of the day, the last thing you read should be, when we do this, this is how it's going to advance the field. So really, I do quite a bit of repetition of that, so that's sort of fresh in their mind. But I don't know.
Those are all great points. Yeah, I think just to expand on that just a little in terms of the approach for every specific game, I would have a section. I call it, I'm reading my own grant that I'm writing now, expected outcomes, rigor, alternatives, and potential limitations. Something like that to summarize what you're expecting to see, or what you're going to be testing and how it relates to your overall significance. But in terms of rigor, I think it should be addressed here. And that includes alternative approaches in case things don't work. If you can see problems, because what it also does is it allows the reviewer to see that you're thinking about what you're doing, and all the minutia that go into doing experiments, and what can go wrong. And I think that's really important. And thinking about the limitations, and what you're going to do if because of those limitations. So I think it's really good to have a good solid paragraph at the end of each specific game just focused on that. I think it'd be cumbersome to have a whole section for all the specific games. I think you should divide it up into each specific game. It makes it a little easier to read. Um, Other than that, yeah, I usually put my preliminary results within each aim. There's no real rhyme or reason to do that. I just find it easier to go from the preliminary results to which stress or emphasize what you've done within that realm of that aim, and it allows the reader or the reviewer to see, specifically, that you have that approach, experience in terms of experience. In terms of details and methodology, if you're proposing to do and you're showing or you're suggesting that you're an expert in a specific kind of unique area, for example, like we do mass spectrometry. I'm not going to get into the details of how our runs are done, but I would show a table, for example, showing that what we call the M/Z, the molecular weight of the individual ions that we're going to be looking at, just to show a table to show that we are an expert in something pretty specific. It's not like you said, PCR. You don't show that. That everybody should be aware of. But something like mass spec, or if you're doing proteomics or metabolomics, show something that shows that you're an expert in that somewhere in your approach. I think that's useful as well. Oh, and one last thing, just sorry, Jennifer, really important, statistics. I mean, everybody knows this. Don't forget your statistics, and really important, show a power table.
Mm-hmm.
right?
Yeah, I was gonna say, like, there's a couple things that will universally get your grant dinged. And one is not showing a sample size determination, how you did that, or having, and this is where it gets tricky. Like, it used to be that they didn't want you to like hide stuff in the well, in our case it's in the human subject section. So I have a whole document on statistical analysis. You still have to have some in the body of the grant. It doesn't have to be as detailed, but I still have kind of a short paragraph on that, and that includes the sample size determination. So if you don't tell them how you came up with your number of people, rats, et cetera, that will be a huge problem. And if any of your aims are dependent on one another, it is a fatal flaw. If your aim 2 and 3 depend on your aim 1 working out the way you think it's going to work out, it'll never get past the study section. So you have to have really distinct aims. I also think like one of the things that you made me think of is like my grants look very different from your grants. So like oftentimes I'm proposing like a major longitudinal study. It's one huge study with 250 kids. And then I have aims like to look at different things in there. So when I'm describing in my approach, I have like my ending paragraph, I am kind of summarizing the limitations of the whole study. But if you're doing a different kind of grant where like each aim is almost like a different study, then you want to do some more interim summaries. And so I think a really valuable thing is to try to get your hands on a grant that is somebody that is doing something similar to what I mean, not necessarily your same work, but a grant that might look like your grant. Because I think the biggest revelation for me when I started reviewing grants was just how different they look and how you can do. I think the biggest part of grantsmanship is you can put whatever you want in this grant. Like if whatever you think is gonna make a reviewer think that your work is important, think that you're important, think that you're the expert in this field, put it in your grant. Make a table, make a graph, make a figure, just say it like explicitly, like I'm the best person to run the study and here's why. Like you can really do anything you want within these pages. There's not really things that are off limits, and that was really freeing. Like what do I want these reviewers to know about me, about my science, about this work, about how this will advance the field? Find a way to put it in the body of your grant. But I think I share my grants with people all the time. I'm happy to share grants that got funded. I'm happy to share the thousands of grants that didn't get funded. Summary statements, maybe not thousands, but a lot. If you look at my comments page, it's like about probably 10 not discussed, 10 grants that didn't get funded for every grant that got funded. I submit something for every cycle. It's brutal. But that's the world in which we live. So I teach a grant writing class and I always share grants with students. So people in my experience, tend to be pretty willing to share their grants. And I think looking at other people's grants, not to like copy what they're doing, but literally to see how people lay their grants out is really eye-opening. Like, oh, I didn't even think about putting a table in for this, or I didn't even think about like adding a section on this. Like it can be really informative to see like how people choose to sell themselves and sell their ideas. And I think it's really useful to get your eyes on as many different people's grants because we all tend to have a style. Like you don't need 5 of my grants, you need 1 of my grants because they look real similar to one another. But getting your eyes on different people's grants, I think can be really useful.
So
Can I
Dr. Lazarus,
can I just
oh, go ahead.
mention something? Yeah, writing a grant is hard. It's hard. It's one of the hardest things to do. And and so confining it to 12 pages where you're trying to say just and be very, very focused is often difficult, especially if you're in a field which is it's kind of a large field which encompasses a broad range of things. So you got just think about focusing your grant as much as possible. That would be my biggest piece of advice as you write your grant.
Yeah. And I think you get better at that as you get like older, more advanced, more further on in your career because when I read a really good grant, it is like simple. It is simple, it is easy to understand, it tells a nice story, and it clearly advances the field. The ones that don't are the ones that get so bogged down, and this grant is going to do everything, and there's so much jammed into it, and it's confusing, it's hard to follow, and so you can really do yourself a disservice by trying to do everything in one grant. Like the more simple, straightforward, tells a nice story and advances the field, like that is the best advice I can give. Sometimes you have an idea maybe, and maybe that is two different grants. Like maybe you really need to focus on one aspect because you will get dinged for being too ambitious. There's a whole discussion of feasibility, and so you can't do everything in one grant.
And one other little thing is, as I was looking here, if you can, to me it helps. I'm not sure what you think, Jennifer, but if in the especially in the significance, if you can have subsections in bold, a little with each paragraph highlighting what that paragraph is about, I think that helps the reviewer. And because if you're just writing a whole big significance section without subsections, it's very difficult to get a good picture of what's really going on sometimes. So I think highlighting each point of emphasis with a subsection title, like 5 or 6 words in bold, that always helps as well.
I love subsections, and my approach in my significance section, the first sentence of each new either section or paragraph is bolded. So it is like adolescence is a critical time period for understanding the development of eating behavior. Bold. And then the rest of the paragraph or set of paragraphs is about that. And then my next section is a sentence that is like a general statement that is bolded. And then that's how I do my section headings now. But it is, yes, it just makes it really crystal clear, helps you transition from one idea to another. I love subsections because you can just pivot hard to something completely different. And when it's in a subsection, it's like, oh, we're going to a new thing right now. And so it actually helps with the flow of the grant. It helps them, they can see like the most important thing. And then my significance section usually has maybe 5 of those things, like the most important things about the field that I'm going to study. So yeah, subsections are huge.
Bolding the first section. See, I'm learning something too. I'm going to start doing that.
So, over the course of my career, I have seen people with, a 12-page limitation that sends something off for comment or critique and asking for help. That's somewhere around 15 pages, or, it's hard to do everything that you're required to do in a very succinct way. Probably tell us if the biggest part of that is the specific aims page. I mean, how do you get to the point where you have one page that is completely and totally compelling and gets people to push forward through the rest?
I'm going to start because I do have to jump off a little early. I'm sorry.
Yeah.
I actually use the NIH manual. I use it to teach grant writing, and I go back to it when I'm writing my specific aims because it is a really nice formula for really the whole grant. If you have never looked at it, I highly recommend it. And they publish new ones every time the guidelines change. So the specific aims is, I think, the most important thing that you write. It is the hardest thing that you write, and it is the first thing that I always write. So whenever I'm coming up with a new grant idea, I sit down and I sketch all the aims because everything builds off of those aims. And so there you have to be really concise. And so it's like, for me though, I think about it very systematically. Like the first paragraph is big picture, but it can't just be like obesity is a, public health crisis or whatever. It has to be like a little more specific. How is your grant going to address, this thing? But then the next paragraph is sort of like, okay, what do we already know about this in very sort of broad strokes, general terms? And then the third paragraph for me is like, the primary aim of my research program is this. The specific aims I'm going to tackle here are this, and then the specific aims, rationale, hypotheses within each one, and then a paragraph at the end about how this is going to advance the field. So if I structure it in a very formulaic way that's guided by the NIH guidelines, but it really forces you to focus on the most important things that you want the reviewer to know, but then you take that same idea and you build those same most important things out in the grant. So that kind of gets back to Rihanna's point, like, how do you know what to focus your significance section on? Well, what things did you focus on in your specific aims? Make sure those are recapitulated in your significance section obviously with more detail. But the aims really help you focus on, what are the things, if a reviewer is only going to read the specific aims, which many reviewers that sit on the study section, unless they've been assigned your grant, might only read the specific aims. So what do you want the 35 people sitting around the room or sitting on that Zoom to know about your grant that's going to convince them that it's important? And so it's really hard to do, but it really forces you to focus on the most high level important things. So I am so sorry that I have to jump off. I got
I
pulled
know.
into another meeting, but if anybody on this meeting wants to look at any of my grants, I'm happy to share with you. Or if you have anything I've said here that you want more detail on, please feel free to email me. I'm happy to share. I'm happy to help anyone through this process again. And we're all in it together. I'm writing a bajillion grants and none of them are getting funded. So, but I'm happy to share what I can if it's useful. So thank you all. This has been
I would
great.
just say, and Dr. Temple, don't get discouraged. You have an amazing career trajectory. And if you just go to NIH Reporter right now, nothing is getting funded right now. It's
No,
not,
I know.
it's
I
not
know. I
you.
mean,
It's not you. Yeah.
it's
Yeah.
sort of like I've done this long enough to not really take it personally.
know.
But it's sort of like, I guess for everybody here, like regardless of what stage you're at, like we are literally all in this together. And I don't know if that's comforting or not. Like maybe it means the downfall of science, but we're all going down together. So I just keep trying and we'll see where we go. But
Thank you for
anyway,
taking the time
thank
to
you
do that.
all. Yeah.
All right.
Bye,
Dr.
Jennifer.
Lazo, any last words of wisdom?
Well, as Jennifer was talking, one thing I could add to some of the things that one should think about. Um, I'll just give an example of what I'm trying to get at. Um, so when I write a grant I've done a lot of research in the tobacco field, and we're looking at trying to help people stop smoking. And the approach is to focus on nicotine. I don't start my specific aims and I don't start my significance by talking about how tobacco kills so many people in the United States and lung cancer is the major problem. That everybody knows. Get to the point. Okay. Start off with nicotine, for example. Don't use throwaway lines at the beginning of your specific aims talking about the global pandemic because of the use of tobacco. Everybody knows that in the field. And so you get right down to what you're talking about, nicotine, for example, or if you're looking at other drugs, or if you're looking at signal transduction pathways important in pancreatic cancer. I wouldn't say, well, pancreatic cancer causes a whole bunch of problems. That is not what you really should be. That's wasting your space, in my view. So that would be another piece of advice as you write your grants, both in the specific aims and in your significance. Get to the point right off the bat and hit it right in that first sentence or two, what you're trying to do and why it's important.
Thank you. So I want to thank Dr. Temple, even though she jumped, and Dr. Lazarus for taking the time to do this and being willing to be so generous with their thoughts and their experiences. We have just a couple of minutes. Does anybody have a question that they would like to pose? Please feel free to just turn on your camera or your audio or put something in the chat. Okay. Seeing none. Dr. Lazarus, the last thing that I want to do is ask you another question that is going to put us past time. But thank you very much for being willing to do this. And so excited that UB was able to recruit you and bring you to Buffalo. And just we appreciate you sharing your experiences.